Picking up with health matters, the 2013 theme for the World Health Day borders on hypertension. We will, however, be looking at the pharmaceutical industry in Nigeria, a very important sector in any economy. Well, in Nigeria, it has grown by 10% on average for the past 5 years. But to take a closer look at the industry is Sam Ohuabunwa, the director at Neimeth Pharmaceuticals. Well, thank you so much for joining us.
Thank you very
much.
Now,
looking at Nigeria's pharmaceutical industry, now, how would you rate the performance of this industry over time?
Well, it's been kind of mixed performance.
Okay.
Overall, we had seen the industry show growth, but the growth has been below standard, below expectations. Mm-hmm. We believe that the industry has the capacity and the potential to do much more than it is doing. But a couple of factors have worked to prevent the realization of this. One being unfair competition through importation of cheaper brands, smuggling, dumping, and all sorts of everybody wanting to be in the Nigerian market but not wanting to come through the front door. The other issues we've had were, of course, the global competitiveness, with products coming from China and India, genuine products. And thirdly, we faced the issue of a little bit of difficulty in getting local consumption of locally made pharmaceuticals. These are factors that have affected the industry, but I think that over time we can see there's a net growth in the industry. There was a time we had a couple of divestments, multinationals divesting from the country because of some of these issues I have raised, regulatory issues, environmental issues, ability to enforce rules and regulations. But one needs to say that there have been some significant improvement, which is now attracting fresh investments. Most of the local industries are kitting up, refurbishing their plants, some are building new ones to meet new global standards, especially WHO requirements. Some are expanding their portfolio and their product range. So I think the industry is seen as some kind of renewal, if you say so.
Going by the capacity rather utilization rate of about, say, 40%, I do agree with you that they are practically underperforming at this point in time. You've just mentioned some factors. Another one that really keeps coming up over the years has been the issue of counterfeiting of drugs. Now, I do understand where you say many have actually divested. That's a major reason for anyone to want to divest. But you saying, you're seeing fresh investors coming in. Are you saying this major issue has been tackled in any way, say, counterfeiting? What do you think is attracting investors back this time?
Well, I believe that they have seen some determination by the government using the regulatory agencies. You found some reasonable, sustained work by NAFDAC. We have seen determination by government to support regulation, to help to create an enabling environment for pharmaceutical industries. We've seen efforts to support availability of funding, especially long-term capital for the industry. These are the kind of things that are attracting investment, because overall Nigeria is an attractive investment destination for pharmaceuticals. But of course, because of the issues we have spoken about earlier on, many investors have been a little bit careful. But now we're seeing a lot of people coming in, even wanting to buy into existing, big international companies wanting to buy into existing Nigerian companies. That's indicative that their confidence is returning. So I think increased regulatory work, the overall effort by government to improve the investment climate, even though we're not yet there, but you can see a government determined. Every day when you speak to the Minister of Trade and Investment, when you speak to Minister of Finance, everybody is targeting how to make this environment much more investor friendly. And I think that's also rubbing off with pharmaceuticals, because after food, pharmaceuticals represent the most next basic need of our people, and that is being taken care of, taken advantage of by all kinds of people. But if we can get investments coming through the front door, I believe that the industry can grow, and it will be better for everybody.
Well, let's take a quick look at how the sector is positioning itself for funding and taking into consideration the demand for drugs that help tackle, HIV and AIDS, malaria, TB, and all that. This, enormous opportunity for pharmaceutical firms here in Nigeria. How's the industry positioning itself for funding? Exactly,
that's what the industry is really targeting now, because most of the funding is international, multinational, multilateral. And they are looking at new standards. It's what they call WHO pre-qualification before you can access some of these global funds. And most Nigerian companies are working towards that, because otherwise they were losing competition to companies Cipla in India and South Africa and in all kinds of other nations. So Nigerian companies are really eager to play, and they're making a lot of investments. A couple of pharmaceutical companies are building new plants, some are refurbishing, some are doing all kinds of opportunities. That also creates, some window for investments to flow in. It creates window both for internal investments. The Bank of Industry and some other banks are being supportive, so that Nigerian companies can compete for these global funds. Right now, that's their major focus.
Well, let's take a quick look at one of the key players in the pharmaceutical sector. That's talking about research. Now, how much of this, has the country really embarked upon when it comes to research, for drugs and medical issues?
Well, that is an area I think we should be doing better than we're currently doing. There are institutes that have been set up, like the Pharmaceutical Research Institute in Abuja, which is directed towards supporting in research. Some universities are doing research, but there has been a little bit of disconnect between these research institutes and industry. And a couple of people are working towards breaking this, closing this gap. The government is doing so, the Pharmaceutical Manufacturers Group are doing so, the West African Pharmaceutical Manufacturers Groups, which are organizations that have had opportunity to serve. Our focus has been to break this gap so that the research that is being done by universities, the research institutes, that the industry takes advantage. And a few companies like that, without sounding immodest, Neimeth, for example, had invested a lot of money in doing a lot of local research, and they are producing some products coming out of that research.
Well, hopefully